And now, coming up next, we have a very special keynote address titled Transforming Healthcare in Indonesia Through Technology and Innovation. And to deliver this address, ladies and gentlemen, it gives me great honor to invite on stage the Vice Minister of Health, Republic of Indonesia, Professor Dr. Dante Saksono Harbuwono, Sp.PD, Ph.D. Let's give a warm welcome to our Vice Minister of Health.
Thank you. Good morning, everybody. Thank you for Dale Street Asia Forum to invite me talking about what actually the healthcare services that we already approved in Indonesia. I would like to present to you about the transforming healthcare in Indonesia through the technology of innovation. Ladies and gentlemen, the Ministry of Health is committed to health system transformation. Next slide, please. Yes, we have the 6-pillar transformation to support Indonesian health. We have one pillar. The first pillar is primary service transformations, and it's talking about the primary healthcare service in all Indonesia. We have about 13,000 primary healthcare in Indonesia, and the second pillar is the transformation of secondary services. It's talking about the hospital in Indonesia. We have 13,000 hospitals in Indonesia. And also we have the third pillar is the health security system transformation. It will maintaining the pharmaceutical medical equipment sector resiliency in Indonesia. So we will be tough if we have a pandemic to these pillars. And the fourth pillar is the health financing system transformation. We have the global financing as we have national health insurance for all of Indonesian people. And the fifth pillar is the health human capital transformation. And I would like to emphasize today is I would like to talk about the health technology transformation. There are two kinds, health technology and biotech technology in Indonesia. Next slide, please. So I will talk first about the health information system in Indonesia. So the government health data facility is mostly not digitalized right now. Mostly. So it thus decreasing the productivity. You will see here some story about in news, some productivity services, lack of services. Patients should be waiting long in clinic, in hospital, mostly in province hospital. So manual non-digital health service influence with effectiveness and efficiency and further trended of quality of public health should be treating. And another thing is the wastage resource due to suboptimal implementation of digital has disastrous consequences for health services. So the government health facility should be mandatory to implementation in healthcare service in Indonesia. So the focus of digital technology will be shifted from reporting to services. This is very important. So for reporting, digitalized that we used previously to services manner. So that all health facility innovate to create application technology system that best serve the people who interact them is very important to our transformation. Next slide. So the integration solution of health information system is we call as Satu Sehat. Satu Sehat is Indonesian health services that will be connected. 10,000 primary healthcare in Indonesia will be connected with 5,000 general practitioners, with 3,000 hospitals, with 11,000 clinics, 1,400 laboratory and pharmacies also. So the connecting all players within the health industry ecosystem is very important, like the hospital, post-mas, or primary healthcare, startup, pharmacy, laboratory, and etc. So Indonesian health services provide specific standardization mechanism for business process data data itself, and the security is very important. So developing they have flexibility to use any programming language as long as they follow the specification and information exchange mechanism defined by Indonesian Health Services. Indonesian Health Services number is heavy, have unique number for every people, so Indonesian Health Services will make people can go to some in one services healthcare to another services that center using the phone, handphone matters. They have specific, and if they go to the laboratory will send the result to their mandatory data in their phone, and they can show to another doctors or another health services. So they have specific number of that unique identifiers for ensure continuous access to health facilities. Next slide. The Satu Data Kesehatan provide region-based health data dashboard for database policy formulation. All data integrated with Satu Sehat is displayed in one data dashboard. It will make database is starting from primary healthcare. All system-related dashboard data analysis at the Ministry of Health are one data dashboard. The data visualize display the dashboard based on the priority Satu Sehat use case, and the One Health data dashboard has accesses sharing up to the provincial city regency offices, health center, so that this unit do not need to build their own dashboard system. So you will see here, previous slide, yes. You will see here the integrated system of the primary healthcare existing system, the startup data and system ecosystem that you already built before will be integrated, and interoperability each other. The every level of dashboard will be also interoperability, so we have one data based on every patient. This is also one part that I would like to talk to you. Another is I would like to talk to you about the precision medicines. So the revolutionary scientific project over time that human already have is three things. The first of the nuclear weapon technology, and the second one is the binary code that we can use for data services in computerized technology models. And the third part that will be emphasized today is the next generation of biotechnology, as we call as the Human Genome Project. It's very important for health service in the future. Next slide. The precision medicines mean that previously, if you will treat patient, you should have analysis with the statistical data, collecting some collecting and analysis in statistic model, that you will have some pattern of the patient that we call as evidence-based medicines. Based on medical based medicines, you will treat patient, but some kind of the medical, evidence-based medical could not be transformed in every patient, because some people have improved outcome after taking the medicines. Some people doesn't have a benefit of the medication, and also the adverse side effect of medication also will have in some patients. For the precision medicine, we'll try to connect the pattern of genomic sequence model and clinical pattern of the patient, and connecting of them with using artificial intelligence. So we have personal medicine for every people. So improving outcome will be increasing in the futures after we use the precision medicines that using the genomic model, and the reduced side effect also identify in the gene of responsible for side effect of medication in every patient, in every disease in the patient. Next slide. So this is a technology improvement, low rapid progress, biotechnology, medical, and genomic science. In the first time, we have biosequencing cost per human gene because we have 3 billion gene in our body, and one gene taking about $1 expense. So in the first time of human genome project, the cost is need about $3 billion. But now the technology will improve, and we have sequence technology is more efficient, more affordable, and highly profitable, because in one sequence in every people that still contain 3 billion gene, the cost is only $100. So it is improving the technology to make the sequencing of human body of gene is only need of $100 per people. Next slide. So 90% of medication is not effective in 50% of patients, despite the demonstrated upside of implementation. Genomic healthcare in Indonesia are yet not benefit from it because of limited understanding of patient genome, unlock personal treatment, and the lack of consolidation in Indonesian biosample collection to be used in drug development is also one of the problem. Another thing is the lack of Indonesian genomic data to use in the underprint innovation is very important. Next slide. The most in treatment diagnosis database development based on Caucasian population. Even Asian people make 60% of the world population, but they are now underrepresented in this data and biobank. So using ourselves mandatory to make our sequence in our region, we will have biobank have been launched in our region, and data is easy to accessible for every people to make not only in precisely medication for treatment in patient, but also to make a political healthcare manner in our program. So this is very important in the future to emphasize the genomic model of technology. Next slide. In the first time I came in the Ministry of Health, the machines is only 19 machines in Indonesia. It's belonging of 12 labs in 2022. But now, 2 years after that, we already have 57 machines of sequence genomic in the people, and we distributed in more than 50. It's already five-fold capacity that can sequencing of genome in Indonesian people right now. Next slide. The potential value of health technology and biotech investment is also good in the high, because of the high demand for advanced healthcare is very important. For example, for the tuberculosis cases in Indonesia, we need 24,000 cases, and for estimated cancer cases, we need about 300,000 cases, and for diabetes, we need 16.5 million people with diabetes. So using this model, using the genomic technology, we try to make demand of advanced healthcare will be important and easy. The biotech global market value is about $1,000 billion, and digital health technology venture capital in Indonesia is already $260 million. Next slide. The Ministry of Health is spreading an initiative to light Leapfrog Indonesia into medical biotechnology and precision medicines. We built the Biomedical and Genome Science Initiative, BGSI, the National Health Biobank, and also combination with the clinical pattern in Indonesia. and the value of ecosystem will be make accessible sample collection in biobank with well annotated data and analysis, link patient medical, demographic, and genomic data, and provide genomic reference for Indonesian population. So we already launched this BGSI on August last year. So next slide. The BGSI will catalyze for multi-stakeholder collaboration to building the ecosystem support development, healthcare, disease surveillance, and result. And we hope can be tried to make a personal medicine more precise in every patient in Indonesia. And also we try to make a novel molecular diagnosis in the future and novel therapeutic also as well. And machine learning and artificial intelligence-based clinical decision support is from the genomic manners, and also data-driven healthcare and early management according genetic marker. This is important. GBSI, not yet, previous slide. So GBSI will try to make the biobank registry and bioinformatics will be connected with some important disease like diabetes, cancer, tuberculosis, rare disease, stroke, and also beauty and wellness healthcare. So it will be composite. This composite will be make collaboration between university, pharmaceutical startup, surveillance, donor, community, healthcare providers, and healthcare service provider. Next slide. The BGSI aim to lead the implementation of this precision medicine in Indonesia, starting with 4 disease screening that are infection disease, cancer, diabetes, and rare disease, and also to pharmacology application like brains, neurological disease, and beauty and wellness. We also collaboration with a big hospital in Indonesia. In the bottom slide, you will see hospital that collaborate with us to support the clinical data, and we try collecting the genomic data, and we mix the clinical pattern and genomic pattern to have the precision medicine that we will give to the patients. So next slide. The BGSI provides secure data storage in the capacity more than 11 petabytes that already have we built. It just only 20 minutes. Whole genome sequencing data set is ready in every patient. Workflow standardization, workflow testing, validation, system hardware evaluation, optimizing is already done, and provide tertiary analysis is also curation, development, and integration already. There are 2 key phases of the BGSI development. Next slide. We try to prove of concept this last year until 2024. Sequencing output should be achieved 10,000 people in Indonesia, but until nationwide scale 2025 to 2029, we try to make 100,000 people to have more detail of the data, more homogeneous of the data of genomic and clinical pattern in Indonesia. Slide. So BGSI will bring 3 key value of Indonesian healthcare system. First is genomics reference for Indonesian population, and the second is decreased potential, decreased burden through accurate diagnosis and better intervention, and also support medical innovation that are better fit for Indonesian population. Together, we can transform healthcare through technology innovation and collaborate between university, funding body, research institute, ministry and regulation body, hospital and laboratory, biopharma companies, startup, technology, community, and also media. That's all that I will introduce to you about our healthcare services in the future, that hopefully you can make some challenge to investing this manner to Indonesia. Thank you very much for your attention.
Thank you so much, Vice Minister. And of course, we'd now like to invite the Vice Minister of Health to take a seat to join us for our fireside chat. And joining the Vice Minister on stage, let us invite Pandu Sjahrir, Managing Partner, Indies Capital Partners. And this fireside chat is titled, Why Indonesia is Ripe for a Long-Term Investment Boom. Without further ado, Pandu and Vice Minister of Health, over to you.
Can you hear? Can you guys hear? No? Can you guys hear? Good morning. We only got about 5-10 minutes karena Pak Minister have to go. So I'm supposed to ask some questions. Pak, I'm just going to ask the most difficult question. Is that okay, Pak? No problem. Pak, I want to invest in healthcare the last 3 years. I want to. And the problem is, I cannot. You know what the biggest problem, Pak? ED. Ikatan Dokter Indonesia, so the Doctor Association. So what are you going to do about them so that we can have high quality talent coming into Indonesia, Pak?
So the most we now in the episode to make some regulation, some undang-undang, the regulation of government to make the government should be to governs in every step of Indonesian healthcare services. Previously, we have a system, mixed system that ED, as Pak Pandu said, is also involved in some regulation. But we try to make that the government in this time is the Ministry of Health try to manage all of things that regulation that can be more easier to investor to coming to Indonesia and to make the Indonesia Ministry of Health will be governed everything they will make a new regulation that we conducting now. So don't worry about the ED because we will govern that should be government from the government.
So no more ED ya, Pak ya?
No more ED.
Ini apa everyone always ask us, Pak, invest in healthcare, Pak. So whenever you want to invest, suddenly that comes out. Number one risk is ED, Pak. Okay. I know this is a public forum. You are in the governing side. I'm just bahasa the Indonesian word is curhat, you know, sharing, Pak.
Sharing.
So, Pak, just 2 more questions. Nah, okay, say ED is no longer governing. So there's simply like an association, Pak, ya?
Yeah.
Similar to an association.
Professional association.
So you had the slides before. If you want us to invest, Pak, where should we invest? Top 2 sector in healthcare.
The top 2 sectors that Indonesia will be very attractive for that you can invest is one of the startup in healthcare is very interesting, the first one. And the second one is biotechnology. Biotechnology is very interesting because, you know, we try to make resiliency of ourselves to make everything we should be developed in Indonesia. So we, you know, in pandemic learned us many things. One thing is the raw material, and 60% of raw material in Indonesia is still imported from abroad. So we try to make our raw material of medications to build in Indonesia. And one of them is for using the biotechnology. So if you want to invest, I suggest 2 things. The investment in the startup model of healthcare because it's very spreading in Indonesia. We use telemedicine in everywhere. We use startup the collecting data, interoperability data in Indonesia, and the second is biotechnology.
Last question, karena Bapak will also meet Minister of Finance soon. Nitip, Pak, nitip boleh kan, Pak? If you're going to invest in biotech, there's 2 things, right? It's quite risky, ya, Pak, ya. What is the tax incentive? Because the investment may not be as big as manufacturing, kan? It's smaller, right? But what is the tax incentive for investing in biotech? Because you have to develop the infrastructure, number 1. Number 2, how can you help us bring the best quality people globally to come here and stay here like a long-term visa, Pak?
Yeah. It's the most interesting is not about tax, Pandu. The most interesting is about it because we will have some incentive but not tax. We want to make, the standardization of the medication that should be affordable in our GKN, in our Indonesia insurance model, is we call as e-catalog. Using e-catalog, the government can buy the medication. And if you build in Indonesia, the Indonesia local content is our value to evaluation, so that you will have a priority to coming in e-catalog. So that's why the intensive that we will make not about tax, but incentive of priority if you will be in Indonesia and as a local production.
And on the human capital side, Pak, researcher, etc., to come here, will you make it easier for them to stay here and long term, Pak?
Yes, of course we will. I already talked to some ministry that related with them. If you coming here, it will make easier to people to have residence here, life here, working here easy to as long as you have a local production of an investment in Indonesia.
Thank you, Pak. Ini Pak Dante is actually a very amazing doctor and suddenly become the Vice Minister of Health, still a practicing doctor and very pragmatic person. So I'm sure, he's doing it only half an hour with us. So thank you, Pak, for spending some time with us. And hopefully, Pak, this year we can all invest in healthcare, ya, Pak, ya?
Hopefully.
Thank you. NED, thank you, Pak.
Thank you.
Please, round of applause to our Vice Minister.
Absolutely wonderful. Thank you so much to our Vice Minister of Health, Republic of Indonesia, Professor Dr. Dante Saksono Harbuwono, Sp.PD, Ph.D. Everybody give a wave to the camera. All right. And after that, you can upload that photo onto LinkedIn as a new cover photo. Ladies and gentlemen, hope you're enjoying our wonderful event so far. Lots of stuff to digest from this morning, so we're going to go for a very, very quick break. Be back here at 11 a.m. Indonesia time, which will be in about 24 minutes time. Please enjoy your break right outside. Be back here at 11 a.m. Jakarta time.